Let's discuss Flow's ability to improve procedural success in GI by increasing completed procedures and reducing poor prep. Flow automates and enhances care specifically to allow for comprehensive management of GI patients. How is she doing that? Flow engages, manages, and monitors patients with personalized and frequent check-ins, as well as real-time education and instruction. All of that has been shown to reduce the clinical burden and allow for better resource utilization. So how is Flow supporting patients and providers? Well, let's start with patients. Flow is going to reach out and introduce herself and then offer support for scheduling, shopping for prep supplies, executing the prep on that day, as well as checking in to get symptoms, offering medication reminders, and answering frequently asked questions. And woven throughout is Flow's ability to educate and encourage patients. For the providers, they are going to be allowed to see alerts, trends, notifications, and analytics in the clinical dashboard. And all customers using Flow have the ability to fully integrate with their EHR platform. So let's take a deeper look at some of these conversations. First, you can see Flow supporting a patient at the pharmacy. This patient has forgotten their shopping list, and Flow offers in real time a replacement list as well as suggestions on substitutions. Secondly, you can see Flow reaching out the day before the prep, making sure the patient is ready to go. This patient has questions about what foods they can eat, as well as what medications they can take. And again, in real time, Flow offers coaching, encouragement, and education for that patient. Finally, and most importantly, you'll see Flow reach out on prep day, taking an otherwise static sheet of prep instructions and turning them into a dynamic conversation between Florence and the patient. Florence not only tells the patient when to do things, but she tells them exactly what to do. And what this has shown time and time again is more engaged patients with better outcomes. So how are we reducing cancellations? Well, again, we've shown that better prepared patients are more engaged patients, and more engaged patients provide better data back to their care teams. And that has led, in our experience, to a 50% reduction in cancellation rates. But we also get tremendous patient feedback. These are some excerpts from some Press Ganey studies that were conducted for a few groups that were using Florence as part of their GI team. The text messages from Flow were very helpful. Flow, the texting person, was great. Great experience. The text messaging was very helpful, and I didn't feel like I was alone through the process. What this shows is that patient satisfaction clearly drives incremental volume for the teams who use Florence. And there's a strong financial ROI simply by reducing cancellations. For one group in Maine using Florence, we saw an additional 20 procedures per week, and that led to 1,000 additional procedures per year. And we were able to demonstrate $1.5 million of additional profit for that group simply by adding Florence onto their GI team. So what questions do you have? Where would you want to get started with Flow? Reach out to our team and set up a short demo to see Flow in action for yourself.